Hi, I'm Garvin. This telecast is on Zimovane. So, why have I been prescribed Zimovane? Zimovane is used for the short-term treatment of insomnia in adults, including difficulties in falling asleep, nocturnal awakening and early awakening, transient, situation or chronic insomnia, and insomnia secondary to psychiatric disturbances in situations where the insomnia is debilitating or is causing severe distress for the patient. Long-term continuous use is not recommended. So what's the dose? You use the lowest dose, effective dose. Zimovane should be taken in a single intake and not re-administered during the same night. For adults, the recommended dose is one Zimovane tablet or 7.5 milligram orally shortly before going to bed. For elderly patients, a lower dose of the 3.75 Zopiclone should be employed to start treatment in the elderly. Depending on effectiveness and acceptability, the dosage subsequently may be increased if clinically necessary. And for the paediatric population, Zopiclone should not be used in children and adolescents less than 18 years of age. The safety and efficacy of Zopiclone in children and adolescents aged less than 18 has not been established. So treatment duration. For transient insomnia, 2 to 5 days. Short-term insomnia, 2 to 3 weeks. A single course of treatment should not continue for longer than 4 weeks, including any tapering off. Extension beyond the maximum treatment period should not take place without re-evaluation of the patient's status. The product should be taken just before retiring for the night. Now, the contraindications. Zimovane is contraindicated in patients with myasthenia gravis, respiratory failure, severe sleep apnea syndrome, severe hepatic insufficiency, hypersensitivity to Zopiclone or any of the other ingredients. As with all hypnotics, Zimovane should not be used in children. So the side effects. Very rare you get angioedema, anaphylactic reaction and psychiatric disorders. Uncommon side effects would be nightmares and agitation, and rare confusional state, libido disorder, irritability and aggression and hallucination. And the side effects unknown would be, an unknown number would be restlessness, delusion, anger, depressed mood, abnormal behaviour, possibly associated with amnesia, and somnambulism, dependence withdrawal syndrome as well, and nervous system disorders. So common would be the nervous system, on the nervous system, common would be dysgeusia, bitter taste, somnolence. Uncommon would be dizziness and headache, and rare amnesia. So cognitive disorders, such as memory impairment, the disturbance in attention, speech disorder, and eye disorders, and respiratory, thoracic, and mediastinal disorders, and rarely dyspnea. So gastrointestinal disorders would be, the common would be dry mouth, nausea and vomiting, and very rare disorders of the gastrointestinal dyspepsia, hepatobiliary disorders, and very rare transaminase increase and or blood alkaline phosphate increased. So skin and subcutaneous tissue disorders. Rarely urticaria or rash, pruritus, and the musculoskeletal and connective tissue disorders, muscular weakness, and general disorders and administration. The uncommon would be fatigue, lightheadedness, incoordination, and withdrawal symptoms have been reported upon discontinuation of Zimovane. Withdrawal symptoms vary and may include rebound insomnia, muscle pain, anxiety, tremor, sweating, agitation, confusion, headache, palpitations, tachycardia, delirium, nightmares, hallucinations, panic attack, muscle aches, cramps, gastrointestinal disturbances, and irritability. In severe cases, the following symptoms may occur: derealization, depersonalization, hyperacusis, numbness, and tingling of the extremities, hypersensitivity to light, noise, and physical contact, hallucinations, In very rare cases, seizures may occur. So could it interact with other tablets? It is important to tell your doctor or pharmacist what medicines you're already taking, including those bought without a prescription and herbal medicines, before you use this medicine. The sedative effect of this medicine will be increased if it is taken with any of the following, which can also cause drowsiness. So alcohol, anti-epileptics, the antipsychotics such as chlorpromazine, the barbiturates, phenobarbital, the benzodiazepines for diazepam, and monoamine oxidase inhibitors, antidepressants, the phenelazine, other sleeping tablets, and sedating antihistamines, chlorphenamine, hydroxyzine, and promethazine, strong opioid painkillers such as morphine and codeine, and the tricyclic and related antidepressants, amitriptyline and mirtazapine. The following medicines may increase the amount of Zopiclone in your blood, and this could increase its sedative effect, as well as increase the risk of its side effects. As a result, your doctor may need to prescribe a lower dose of Zopiclone if you're taking any of these: clarithromycin, erythromycin, itraconazole, ketoconazole, and ritonavir. The following medicines may decrease the amount of drug in your blood, and so could make it less effective. As a result, your doctor may need to prescribe you a higher than normal dose of Zopiclone if you are taking any of these: carbamazepine, phenobarbital, phenytoin, rifampicin, and the herbal remedy St. John's wort. If Zopiclone is used with strong opioid painkillers such as morphine, this can result in an increase in the euphoric effect that these painkillers can have. This could lead to an increased risk of psychological dependence on the painkiller. So what if you're pregnant or breastfeeding? Certain medicines should not be used during pregnancy or breastfeeding. However, other medicines may be safely used in pregnancy or breastfeeding, providing the benefits to the mother outweigh the risks to the unborn baby. Always inform your doctor if you are pregnant or planning a pregnancy before using any medicine. The safety of this medicine for use during pregnancy has not been established. The manufacturer recommends that it is not used during pregnancy. This is particularly important during the third trimester of pregnancy and during labour. Regular use of this medicine during the later stages of pregnancy can cause withdrawal symptoms in the baby. So you can seek further medical advice from your GP. If you suspect that you could be pregnant or are planning a pregnancy while taking this medicine, you should speak to your doctor about stopping treatment. Significant amounts of this medicine may pass into breast milk. It should not be used by breastfeeding mothers, as it may be harmful to the nursing infant. Again, seek medical advice from your GP. If you have any questions, you can contact me through the live pharmacist. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.